For the first time in a decade, doctors are racing to contain an outbreak of Ebola, this time in the Democratic Republic of the Congo and Uganda. Those in Texas 10 years ago likely remember the rare virus, often fatal. The CDC says right now there are no cases of this disease in the U.S. and says the overall risk here remains low. But a missionary group has confirmed that an American doctor working in Africa has tested positive for the virus. U.S. officials say they are working to move that patient to Germany for treatment and care. Doctors say Germany has previous experience, like Texas, caring for Ebola patients. Mandy Gaither this afternoon on what we know about this outbreak.
This outbreak is being caused by an infection with the Bundibugyo Ebola virus. It's primarily found in sub-Saharan Africa and can cause serious, often deadly disease, with an estimated mortality rate between 25 and 40%. There's no approved vaccine or treatment for this strain.
May 17th was this declaration of a public health emergency of international concern, which basically means that this was a serious event, a sudden event, an unexpected event, and that there's implications beyond the borders that you're seeing there.
The outbreak in the Democratic Republic of Congo and Uganda has killed more than 130 people, according to DRC officials. And an international charity confirms an American missionary physician, Dr. Peter Stafford, has tested positive for the virus while working in DRC. The charity says his wife and another physician are now being monitored, but are currently asymptomatic. The CDC says Ebola symptoms can start 2 to 21 days after contact with the virus and may include fever, aches, pains, and fatigue. But as the person gets sicker, they can experience diarrhea, vomiting, and unexplained bleeding. It's spread through contact with the body fluids of an infected person, including the handling of contaminated materials of someone who died from the disease.
If you sort of combine all these things, lack of testing, volatile area, some of the cuts, it's not surprising to have a situation like we see unfolding right now.
For Health Minute, I'm Mandy Gaither.
While the CDC says the immediate risk to the U.S. public is low, the agency did invoke something called Title 42. It's a public health law and forbids any visitor from coming into this country if they have been in the Democratic Republic of the Congo, Uganda, or South Sudan any time in the last 3 weeks.
It's a really scary and lonely thing to be that sick, but also to know that it's Ebola.
Kent Brantley there is a doctor from Fort Worth who got Ebola and survived. He recounted it to Teresa Woodard. Their unedited conversation available this afternoon on WFAA Plus, our free streaming app, free to download there on your mobile phone or on your smart TV.